Some studies have seemed to show that statins have a beneficial effect on ventricular arrhythmic complications. Now, in the European Heart Journal, there is another study that disputes that notion by testing whether statins reduce the risk of ventricular tachyarrhythmia, cardiac arrest, and sudden cardiac death. They did a meta-analysis searching the databases Medline, Embase, and Central and found 29 randomized control trials comparing statins with no statins, or comparing intensive versus standard dose statin with more than 100 participants and at least 6-month follow-up. In these trials, statin therapy did not significantly reduce the risk of ventricular tachyarrhythmia or of cardiac arrest, but was associated with a significant 10% reduction in sudden cardiac death, compared to a 22% reduction in the risk of other so-called non-sudden, mostly atherosclerotic cardiac deaths. Interestingly, the results were not materially altered by inclusion of 8 trials of intensive versus standard dose statin regimens. So what do we learn from this study? Statins have a modest beneficial effect on sudden cardiac death. However, previous suggestions of a substantial protective effect on ventricular arrhythmic events could not be supported by this study. I'm Peter Block, and this is a CardioSource Heart Minute.